So across the state and across the nation, we are seeing a significant drop in emergency department visits. Some locations greater than 50%, some locations lower than that. There are certain hotspot areas of COVID-19 where volumes are significantly elevated, but for the most part across the country, volumes are down. So while there has been some sensationalized messaging that every emergency department is overwhelmed, that is not the case. And it is not passing any message that we are not able to take care of you for your chest discomfort, for your stroke symptoms, for your appendicitis. It is not appropriate. We are here. We are here. We are capable. We have the space. We can keep you safe. When the coronavirus pandemic started hitting our area, we did see a fair amount of patients with COVID-19. And we've started to see that trail off at our facility to a degree. But what we have also noticed is that patients with all other non-coronavirus, non-COVID emergencies stopped coming. And that is not the message that we've been trying to get out in terms of utilization of the emergency department. We are seeing a significant drop in people presenting with heart attacks. And so people are staying at home with those. People are staying at home with strokes. People are staying at home with appendicitis, diverticulitis, all sorts of rather severe medical emergencies. And rather than coming into the emergency department, they're staying home and suffering the consequences of these. And that is not the message that we want to present and send out to the population. We are here for you. We have plenty of space to be able to take care of patients. Our volume has gone down considerably. We have multiple open beds in the emergency department, and it is safe to be here. We have taken significant measures to ensure that our patients who are not presenting with coronavirus COVID-19 are just as safe as the ones that that do have symptoms of the disease. If you are having an emergency of another nature, come to the emergency department. You do not need to call ahead. You can just come in, and we will see you rapidly, treat you appropriately, and take good care of you. We are having everyone wear a mask. As you see, I'm wearing a mask at this time, which decreases transmission from people who have the disease to others as well. We've decreased visitors, not as a punitive measure, but just to decrease the amount of people in the hospital and follow the CDC guidelines on that to decrease the possibility of transmission. Our staff is also wearing masks, and some of them are more intricate than others, mostly because, as people know, there's a national supply issue, and we are doing what we can to make sure we protect ourselves as well. This is one of the masks that you might end up seeing us evaluate you in. This is a commercial grade mask with N95 protection. This is entirely being used just to keep the supply chain of N95s up for everybody else in the hospital who may need them. This is not an indication of severity of illness. This is not an indication that we are scared or concerned to see you. This is only to conserve personal protective equipment for the hospital. But we're here for you. We are absolutely here to take care of any emergent need. We have the space, we have the capability to keep you safe, and we want you to come if you're having an emergency. Please do not stay home and suffer in silence. Please don't do that.